Hi, I'm Morgan Cups. I'm doing assessment number 2, and then this is the photographic release form on Lori Oberg. And do you consent to the video?
Yes, I do.
And then a 360 of the room. So I would start by coming into the room and introducing myself to the patient. So hi, my name's Morgan. I'm going to be your nurse today. I would wash my hands and put gloves on if necessary, and I would tell her what we're doing. So we're doing an assessment over your heart, your upper and lower extremities. After doing that, I would ask her about her past medical history. So do you have a history of arthritis?
No, I do not.
Do you have a history of congestive heart failure?
No, I do not.
After doing that, now I'm going to listen to your heart. That's the aortic. Pulmonic. Erb's point. Tricuspid. And mitral. And now I'm going to listen for 30 seconds using the clock on the wall to count her rhythm and the rate. The rate of her heart was around 74 beats per minute, and it was strong and regular. So after doing that, I'm going to assess your upper extremities. So can I have you put both your arms out in front of you? So looking at her arms, you can see that they are symmetrical and bilateral. It doesn't appear that there's any lesions on her arms. Now I'm going to have you squeeze my fingers. And the grip is also good, and it's the same on both sides. Now I'm going to assess your legs. So looking at her legs to start, it's a tan color. There are a few lesions on her legs. There is no venous patterning on them. And it looks like there is some freckles on there, but that's about it. And so after assessing the appearance of her legs, I'm going to look at the primary, secondary, and vascular lesions. So primary lesions, there is a freckle right here. It's about the size of a fingertip. It is distal to the knee, about halfway down the leg, and it is circular. There are a few other, and that's a primary lesion. There are other freckles. They're all about the size of a pinhead. And they're all circular, brown colored, and spread out throughout the skin evenly. Secondary lesions, there are some scarring right here. It is shaped more like an oval. It's distal to the knee. It looks like it is healed over well. And then there are some vascular lesions with cuts in the skin and breaks on her left leg. And they look like they're healing well, and there's no reason for concern. Next, I'm going to test the moisture of the legs, and there is no moisture on them, which is good. And now I'm going to assess for edema. So there's no pitting as I go down her legs, which is good on the left. And there's also no pitting on the right. Now I'm going to assess her tibial pulse, so going down the middle of the toe. It's a grade 2, and it is elastic. And then her dorsal, which is also grade 2 and elastic. And that is the conclusion of my assessment. Thank you.